Masterclass 1 and Masterclass 2 are representing our main project regarding the bone augmentation. It's a sort of journey that anyone can perform independently from the starting position or experience, because we are going through the strategical choices in bone augmentation, meaning how to analyze the defect, how to perform a correct selection of a material, a correct selection of a technique to be predictable in terms of bone augmentation. That sometimes it doesn't mean to have vital bone, but also in many cases it means to have a contour, a new contour that is going to support and optimize the aesthetic result of our restoration. So this journey is starting from the bases that are fundamental, and we are going to appreciate how, from a biological point of view, we have a sort of red line connecting a post-extraction site behavior to a vertical bone augmentation with a non-resolvable membrane. But once we have this concept clear in our mind, then we can have the freedom to define our strategy to solve the specific problem of a patient. And through this journey, we are going to touch, obviously, in the depth, also the soft tissue management, how to perform the correct incision line, how to obtain the primary wound healing, which is crucial in bone augmentation procedure. And nowadays, looking the literature, is still the main problem that we have in bone regeneration procedures. So we are going to go through this. We are going to analyze also the GBR approaches with the simultaneous implant placement in the horizontal augmentation, in the vertical augmentation. And then we have the chance in the Masterclass 2 to jump into the digital world of the Curie technique in terms of prognosis, of diagnosis, of planning, digitally planning of a bone harvesting, and then how to manage digitally the bone block and how to perform guided the block fixation into the mouth. So we are going to see how the digital approach is changing completely the difficulties related to the freehand approach in the Curie technique. But not just this, we are going to analyze how to improve the aesthetic management of the soft tissue, how we can increase the volume of the soft tissue, because we are going to understand from the day one of our journey that every time we have a deficiency is always a combination of a hard tissue and soft tissue deficiency. So we have to understand where we can go to the bone and where we have to go then later on with the soft tissue augmentation. So this is a journey that is important because it's bringing us into the regeneration rules and how to transform these rules and this concept into practical concept, into a surgery that we can perform in our clinical day. And then not just this, we have the chance to add a 1 day on cadaver, meaning that we have the chance to simulate everything from the computer-guided bone harvesting and the Curie technique to perform a GBR, a post-extraction site management on the cadaver in a very intensive full day dedicated to this. So to understand also the difficulties in terms of working space, working view that we have in a real patient. So we are expecting you in our Your Dental Future program of bone augmentation. Not just a program, it's a journey.